Radio doctor today is Dr. Collins Aboloje. He's an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta. And this morning we're going to be talking about egg freezing. Before I get ahead of myself, good morning, Dr. Collins. How are you?
Good morning, family. I'm doing great. Nice
Awesome.
to be on the program again.
Yeah. Yes, it's really, really lovely to have you. Thank you so much for doing this with us. Right, so we're going to be talking about egg freezing. We are live on YouTube at the WFM 917, and you can listen to us on the go via our website, www.wfm917.com. The phone lines will be open shortly, but you can start sending your text messages, WhatsApp messages, or voice notes to 08155 917 917 or 0703-1756-537. Okay, let's get into it this morning. Egg freezing. Dr. Collins, what is egg freezing?
All right, thank you for that question. So, egg freezing is simply one of the ways to preserve the fertility of women. There are other ways to preserve the fertility of women, but egg freezing is one of them. And egg freezing simply means the act of freezing eggs. Eggs are the reproductive cells of women, okay? That are they contribute to the formation of an embryo and ultimately a baby. So what happens in egg freezing is that eggs are gotten from from a woman, and then of course vitrified. Vitrification is simply a process of ultra rapidly freezing eggs, okay? And you do this by dipping the eggs, okay, into liquid nitrogen. And these can stay frozen for an unlimited period of time. So that is what egg freezing is. It's simply the act of freezing the eggs of women to be used at a later date by dipping the eggs into liquid nitrogen storage containers. Actually, it's not like the eggs are taken and just thrown into the liquid nitrogen. So basically what is done is that once eggs are collected from a woman, they are placed into special cryoprotectants and placed into special protective containers. Let me use that word. And then dipped into a storage container, a container that contains liquid nitrogen. And this liquid nitrogen has a temperature of roughly minus 196 degrees centigrade. Water freezes at 0 degrees centigrade. So you can just imagine the temperature of that liquid nitrogen. So it is something that freezes any tissue or cell rapidly. Okay. So, and this can be kept frozen in that cryo state for an unlimited period of time until when the woman is ready for conception. Then the eggs will be used for IVF, okay, in order to allow her to get pregnant. Okay, this is actually a modality that is currently being embraced by a lot of women. I mean, recently I saw a post of one of the celebrities online where she went to a different country, one of the neighboring countries, to have this procedure done. So a lot of people are warming up to that idea of freezing their eggs. And because in the past, once a woman gets a particular age, I mean, because of our sociocultural standards and biases and prejudices, we expect a woman to have attained certain things in life or to be facing a particular direction. Marriage, okay? So basically these days, that is not paramount for women. So a lot of women are trying to just better their lives. They don't have to depend on some man or depend on marriage to allow them to be able to obtain a particular status in life. So a lot of people are pursuing their dreams. And this is what is now giving this credence, and making a lot of people warm up to the idea of freezing their eggs. Okay, there are certain reasons. Actually, the egg freezing actually came on the back of people who had who wanted to preserve their fertility, maybe for two principal reasons. Actually, for people who want to delay motherhood, and for women who also maybe have cancer and they want to go for treatment. And the treatment would, of course, damage the reproductive tissue or reproductive cells in the body. So this is like a form of having, is it an insurance now, or what do we call this? Okay, where they have eggs saved to be used for later.
As and it told you as forward thinking as I think I am and liberated in my thinking, honestly, I'm just like, when it comes to egg freezing. But I do see the value of it, especially for women who maybe at age there is something for the something they're not married yet and they still plan to have children. I do see the value for it. I mean, there's also the ethical part of it in terms of why women intentionally delaying childbirth or delaying having children because they want to do other things. But at the same time, I'm like, I get it, because I know how many careers have had to be stalled because of children. I know what happened to me when I started having children, so I get it. So sometimes as an 80s baby, sometimes the Gen X that I narrowly missed, fights with my millennial / Gen Z, whatever. But I do get it. And yeah, thank you for answering that question. But the thing is, we live in Nigeria. Like, when we hear about freezing, most times is like, oh, it's an Oyinbo thing, because the culture we have here is one of the moment you're being groomed for child, you're being groomed as an incubator to be giving birth from when you were born. Let's not lie, because a young girl is being groomed to start taking care of the house because she's going to be somebody's wife and somebody's mother. This girl is 8, maybe this girl is 10. She still has like years and years
ahead of her. Yeah.
So I don't understand. But in a country like Nigeria, where this is not our culture, this is not something that we buy into, what would you say the most common reasons for women in Nigeria who are choosing to freeze their eggs might be?
Okay, thank you very much. So basically, one of the common reasons, or let me just state a few, is first of all, okay, people who are trying to delay motherhood. And this is largely because of lack of job or financial stability, truthfully. I mean, the economy is biting hard. I mean, the economic crunch biting really hard. So a lot of people are trying to say, okay, yes, I just need to make my life better. I don't have to depend on I don't have to just let life just determine the way my own destiny goes. So basically, everyone's trying to, just give life a little bit of that boost thing. So basically, largely lack of job or financial stability. And the next, of course, is the absence of the right partner. So you see certain people, maybe the current relationship that they are currently in, maybe they are not too sure about their current partner, to have a family with. So for that reason, they tends to, it becomes the reason why they delay motherhood. And then they will tend to be like, yeah, maybe I should just freeze my eggs until when I find the right partner, because age is not on the woman's side. And then you can't determine when a woman you can't actually determine when a particular woman should get married. There's just a generalized thing right there that, okay, once you're getting to 30, make sure you try to get married. But it doesn't work that way for everyone. So for certain persons, like we said, now the variables change. Like, okay, what if the person doesn't have the right partner? What does the person do? And age is something that is progressive. Age is not going to wait for you. It is time. It passes. Whether you like you're doing anything or you're not doing anything about your life, it just keeps on progressing. And of course, the changes that are associated with the advancement in age will continue to happen in the body. Eggs, quantity, and the quality diminish with time. So as a woman advances in age, especially after the age of 35, it becomes significant. But that reduction actually starts from the age of 30. So, like I said, people are freezing their eggs now because they do not have the right partner currently, and age is not on their side. So they just want to keep some eggs, in the egg bank, up to when they will be ready for maybe they find the right partner, they're ready to settle down with, and then of course they can make use of their eggs. Okay, then like I said, lack of financial or job stability. Then diminishing ovarian reserve. So for some women, they have what we call diminishing ovarian reserve. So basically, their eggs have started to become very low. So and they are still not, maybe they still do not have a partner yet. Again, everything still again boils down now to the partner, the readiness to want to settle down in marriage and all. It's still they are just tied together. They're just like it's just like a chain mechanism. Yeah. So basically, diminishing ovarian reserve. Then we have some certain people that have medical conditions. okay, like fibroids very large size fibroids that have been disturbing them or preventing them from getting pregnant. So they want to take care of that first before they attempt conception. But then you don't have to necessarily wait to remove the fibroids first before. So what certain people do is just like a way of acting very, very smart, truthfully. They get eggs frozen so that whatever time it takes them to come to that point of making up their mind to have surgery done or to take care of the fibroids, then of course it won't disturb their fertility per se because they already have eggs backed up and saved up somewhere as a
Right.
backup plan to be used at a later time. Okay. Then medical conditions like endometriosis. Okay.
Mm-hmm.
And people are freezing their eggs because they've been diagnosed with endometriosis. And endometriosis is a chronic condition that progressively has impact on the egg quantity and the quality. And of
Okay.
course, overall, it affects the fertility of a woman. And in fact, it's a very common cause of infertility in a woman. So, because of its progressive nature, the moment that diagnosis is established, some of the modalities that women can engage is to freeze eggs because the endometriosis does not just affect the uterus, it affects even the ovaries. And the
Mm.
ovaries are the organs that produce the eggs. For some women, they have what we call endometriomas. Usually, that is what can be found in the later stage of having endometriosis. So you don't want to wait till when you start to develop endometriomas in the ovaries before you go to save eggs or freeze eggs. So these are some of the reasons. So women are freezing their eggs because of medical conditions, lack of job and financial stability, lack of right partner, having conditions, having a diminished ovarian reserve, and just the sheer need to want to enjoy one's life. I mean, we live in a day and age where a lot of people are quite liberal about their thoughts processes. They are not just confined to a particular way of thinking, the one that was shipped into their minds by their parents. I mean, these days, a lot of people are just open to anything that works for them, they're good to go. So you find young people saying that, no, I'm not going to get married until I'm 35. And there's nothing you can do to force them because they already have their life planned out in a particular way. They want to attain a higher degree, they want to get very financially stable, they don't want to have to depend on a man. Because I mean, the idea we had by upbringing, just like you said, you see a 10-year-old child, the mom, while trying to rebuke the child for doing something wrong, they're saying, is this what you're going to be doing in your husband's house? I mean, just like you said, child is still quite
Yeah.
young. That child has a lot of things to learn along the way and has a life ahead of her. So you can't be cheating the idea. You're not just grooming a child for marriage. A lot of people have their life. We keep forgetting that both genders, as a man and a woman, okay, we have our lives before us and we have certain things we have to financially to get financially, even emotionally, and just overall well-being. So it's not about getting married. And a lot of people have seen marriage as a way of escape, of just like as if one is escaping one very dire situation and going into a place of respite and a place of solace and rest. So that's what it is. That's what marriage is for certain people. But these days, people are not seeing marriage that way. A lot of people want to acquire things financially, want to get to that point of stability, all wise before they even attempt to go into marriage.
Hmm. Thank you so much for that, Dr. Collins. The one I wanted to pick on is so the ovarian, like if you're having issues with your ovaries, basically. So that's to
Yeah.
say that um it's better to save them on time before they now diminish. You said diminishing something. So save them on time before it diminishes, isn't it?
Yes,
Because
ideally, yeah.
older we get, the quality of the
The
eggs
quality
reduces.
diminishes. Exactly. So it is better to
Yeah,
save on time when the quality is still very, very top notch, so to say, still very, very
right.
high. Because as a woman advances in age, the quality of the eggs reduces, even the quantity reduces. But the one that is most important to a physician generally is the quality of the egg. Because the quality of the egg would largely determine whether the eggs get fertilized and what quality of embryos can form from that same egg in the future. Okay, so this is the reason why it is better women freeze their eggs on time. There is an age that has been stipulated for women to freeze their eggs, where it is guaranteed that the quality of eggs they produce, will still be of good quality, will still be very high,
Mhm.
relative to when they attempt to freeze their eggs at a later age. And this age is actually between the ages of 25 and 35. So it's safe to say
Right.
being in your mid 20s down to your mid 30s. The moment you start, your age starts to span beyond 35, it
Wow,
is not
wow, wow.
advised anymore because at that age, the quality of the eggs are started to diminish. Of course, we're not saying that it is still, it's not, we're not saying that you still can't attempt it once you're already above 35. I mean, all sizes are not, all fingers are not equal. So for certain people, I mean, being in the practice of the reproductive medicine, basically, I've seen a 38-year-old woman produce about 14, 15 eggs, in a cycle of stimulation. And then I've seen a younger lady, maybe 28, produce just about 7. You see,
Huh.
whereas the case is supposed to be reversed.
Yeah.
Yeah, it's supposed to be
Yeah.
interchanged, where the younger person produces a lot more eggs, there's cycle of stimulation relative to somebody who is already mid-30s and above. That person is expected to produce, well, at least something lesser than the other counterpart. So these are the realities, and these are the pictures that we tend to see in the practice. So this is the reason why it is stipulated that women freeze their eggs when they are between the ages of when you're between mid-20s and mid-30s.
Is it possible for a woman to not have good eggs at all?
Okay, yes. So basically, the answer to that question is yes. So certain conditions actually promote or actually predispose to a woman not having good quality eggs. Conditions like endometriosis. We've also seen cases of women having poor quality eggs, women who have polycystic ovarian syndrome. Yes, we know
Wow.
polycystic ovarian syndrome also predisposes a woman to producing a lot of eggs, but many of them might be immature and, of course, of altered quality that will, of course, impact on the quality of the embryos that come from the eggs. So,
So in that
and then
case, she cannot freeze her eggs in that case.
so basically, in those cases now, basically some other things have to be done, like trying to improve, just trying to engage
The
modalities that would
line.
allow the quality of the eggs to improve. Again, quality of life. I don't want to use the word quality of life. Lifestyle factors like maybe obesity, alcohol, smoking. These things can actually affect the quality of eggs of a woman. So again, sometimes these are largely transient. So the moment the woman improves her lifestyle, she stops taking alcohol, stops smoking, engage exercise, starts doing exercises, taking a balanced diet, fruits, vegetables, rich in antioxidants, all of these factors, you tend to see a reversal in the quality of the egg. So, but as far as the person continues engaging wrong lifestyle practices, of course, it would affect the quality of the egg.
Hmm. Wow, 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 wow. Okay. So can you walk us through what happens from the moment a woman decides that she wants to freeze her eggs? What's the process?
Okay, so basically, egg freezing for people who are listening, it is readily available to the general public. You don't need any special consent to do egg freezing. But any which is, you have to be an adult. And then, of course, when you walk into the clinic, there are about 5 stages that the woman has to go through. Okay, first of all, she has to be evaluated. She has to go through fertility assessment and evaluation. After that will be arrived at when she consults with her gynae or fertility physician. And then the next thing is, of course, the controlled ovarian stimulation. This ovarian stimulation is a process that simply involves giving injections to the lady. These injections, they are either follicular stimulating hormone or even it contains hormones any which ways. And these hormones, what they are meant to do is to cause follicles to develop in the ovaries. So this is what happens. Ideally, every month, only one follicle develops and reaches maturity, only one, okay, in a woman. And then that follicle ruptures and releases the egg that is present within it. Okay, so this is what happens. But in this case, we're not going to be depending on the ovaries to just produce one egg for us. So what we do, we give all the hormonal injections to cause polyfollicular development. So a lot of follicles develop. So multifollicular development. So a lot of follicles will develop in the ovaries to reach the size of maturity. Okay, so that is what we call controlled ovarian stimulation. The next thing, of course, we have to do follicular tracking. You have to track the development of the follicles as the day goes by. Okay, there are specific days that are allotted for follicular tracking. That is part of the process, and that is step number 3. Number 4 is the egg retrieval. Egg retrieval is simply a procedure that is done in the theater. The woman is put to sleep, and of course, a transvaginal ultrasound scan is done for her alongside a needle, attached to a vacuum pump is passed through the vagina to aspirate the follicles. Don't worry, she's put to sleep so she doesn't feel any pain. Okay, she won't feel any pain. In some centers, they do this using a spinal anesthesia where the woman doesn't feel anything. She's awake, but she doesn't feel anything from waist down. Okay, for some other centers, they use what we call conscious sedation. Okay, there are a lot of forms, there are other forms of anesthesia that can be used during this process, but overall, the woman will not feel a single pinch of pain during this procedure. Okay, procedure usually will take roughly 20 to 30 minutes. The follicles would have been aspirated, and of course, these follicles that are aspirated, the follicles is the fluid that are present inside of the follicles in the ovaries that are collected and handed over to the embryologist, who would pick out the eggs from inside of this follicular fluid and then freeze them. So the last phase after a follicular aspiration is, of course, the egg retrieval and then the vitrification, which is the freezing of the eggs. So generally, there are 5 steps. Let me go over it again. It's the consultation. The next, of course, consultation and fertility assessment. The next phase is ovarian stimulation. After that, follicular tracking, the egg retrieval, and then, of course, the vitrification of the egg, which is the 5th phase, which is the freezing of the egg. Like I said earlier, vitrification is a form of ultra-rapid freezing of eggs. Okay, so basically, these are the steps that have to be undertaken by a woman who wants to do egg freezing. Usually, all of this process can happen within a month, truthfully. The stimulation down to the egg retrieval will take roughly 3 weeks. Okay, but just to add the portion where you have to evaluate the woman to do run tests and all of that, usually just include a week to that. So basically, within 4 weeks, the woman can have her eggs gotten, collected, and frozen.
So, but it's not all the eggs, Sha. It will just
Okay.
or how many eggs are they taking?
Okay, beautiful. So all eggs, all the egg, there's no way you can take all the eggs of a woman per cycle of
Okay.
retrieval. It is not possible. So basically, whatever amount of eggs the woman is able to produce per cycle of stimulation will be taken, and then maybe she can attempt to get another, go for another cycle again. So when a woman is under the age of 35, okay, we attempt to take at least roughly 20 to 25 eggs. Attempt to freeze between 20 to 25
because it's
eggs.
just one egg you need for a baby.
Yes, in real sense, it's just one egg you need for a baby. But when you're freezing, it is expected you freeze a lot more. Okay, it's expected you freeze a lot more. Now, the reason is because there is no other way to pass those eggs back into the ovaries. The woman would have to use those eggs for IVF in order to help her conceive. Once eggs have been taken off the ovaries, there's no way to inject them back into the ovaries. The woman must do IVF in order to allow her to conceive. So it is better you take a lot of eggs because those eggs would have to become embryos in order for them to become babies. Okay, and a lot of things might happen during the insemination phase of the eggs and the fertilization outcome. So you see certain eggs will get lost in the entire process. Okay, when it is time for IVF to be done. Exactly. So this is the reason why you take a lot of eggs. You don't want to just take only one. Then that is penny wise, pound foolish. If you're trying to freeze something, you freeze a lot of it. You don't just freeze 1 or 2. So this is the reason why we advise women to freeze, at least if you're under the age of 35, freeze between 20 to 25 eggs. If you're above the age of 35, freeze a lot more eggs. You have to freeze more than 25 eggs. It is better. The reason is because of the diminished quality of the eggs. So you see that within the cohort of eggs that you get, you see some of them that already have some form of dysmorphisms because of the age-related fertility decline. Okay, so this is the reason why you freeze a lot of eggs. So that despite all the dysmorphisms, which are the altered shape or altered quality of eggs, you'll still be able to see a few that will still be of good quality within. But if you're taking fewer eggs, then chances are excellent. A lot of them will be of poor quality. And of course, at the end of the day, the freezing of the eggs defeats the purpose for which you're doing it, which is, of course, to achieve conception at a later age. Yeah.
women are going through a lot. How am I ever going to laugh? And I know that we always say this whenever you come on. I'm like, wow, women are going through a lot. So what about the body? Like, because you say the cycle of stimulation. Are there hormonal drugs given to the woman? What happens to her body during this? It's just now I'm realizing that this is the same process to get eggs for IVF, right?
Excellent. Yes, yes, that's
So
an excellent
what
observation.
happens with the woman's body from the moment she says, "Oh, I want," like from the process, "Oh, I'm getting my eggs removed, I mean retrieved, not removed. I
Yeah,
want to
yeah.
take them," to when they finally taking them to post care. What happens?
Okay, so now I'll just digress a little bit and come back to that question. So basically, this is just to let people know that when you're trying to store or freeze eggs, the ovaries of the woman are not removed. The ovaries are the reproductive organs that produce the eggs of women. They are not removed during this process. Okay, so the organs are not harvested. Yes, for people who are used to harvesting up and down, okay, the organs are not harvested. Rather, the eggs that are present within them, okay, will be removed, okay, will be aspirated, okay, will be removed, will be taken from the ovaries. And you have to know that you cannot finish the eggs in the ovaries, so to say. So even if you're able to retrieve maybe 14 or 15 eggs at a go, within the next 3 months, you can stimulate that woman and she can produce the same number or even higher. Okay, so it's not like, okay, the woman has the capacity to produce 400,000 eggs from puberty till when she attains menopause. But of this number, only 400 eggs will be released, you know, when she, like naturally, only 400 eggs will be released, you know, but she has the capacity to produce 400,000 eggs. So even if she produces 25 eggs every 6 months, and when she goes for egg freezing, to get eggs to freeze, to store, it still will not deplete the ovarian store of the eggs. Okay, so that is just a small digression. Okay, and now back to the question. So when the woman decides to go for egg freezing, basically hormones are given to the woman. That's hormonal preparations. That is what stimulates the growth of the eggs, okay, to maturity inside of the ovaries. Okay, so during this process, there are certain things that the woman can experience, like mild bloating, okay, especially once she's done during the process of taking the injection, she starts to experience some small complaints like bloating of the tummy. It's mild, usually it is mild bloating, and of course nipple tenderness. Some persons start to feel some lower abdominal pain. There could be mood changes. Yes, there could be mood changes. Well, and basically this is it. It's just usually these are things that are largely transient. Okay, but once the process is concluded, all of these symptoms subside and everything returns back to normal. These are just largely side effects of the follicles of the ovaries increasing in size because of the follicular development inside of it. And of course, the other things that they experience, like the nipple tenderness, are just the expression of the activity of hormones inside of the body.
Sorry, I'm just thinking. What about weight gain? Does weight gain happen? Any of that? No, or
Well,
just
well, Well, truthfully, this does not happen in everyone, but maybe for some persons, they at the end of the procedure might be like, "Oh, maybe I just gained an extra pound, or maybe an extra kg, or an extra." But really, it is not something that is it's not something that is so expressed. Okay, it is not something that's so expressed. But then, of course, we've seen cases of women attaining weight gain. Of course, hormones generally can, well, usually we say they cause bloating. The bloating in this case now is not the bloating of the tummy, it's just general weight changes. Of course, that is what they do. But this is not something that the woman is doing every month. Okay, she does it now, gets a couple of eggs, say if she has the number that is required to be frozen, 20 or 25, as the case might be, could even be less. Different centers have their capacity, whatever SOP they follow, to get eggs frozen. So between 18 to 20 for some people, ideally for some other persons, we require 20 to 25. So, but in general, weight gain is expected, but it is not present in everyone. Okay, but it's expected. So when it happens, we're not like, oh, you're having your weight has changed. Yes, it is
yeah.
just part of the process of taking hormonal preparations generally. So that's the reason why I had to use that statement. So it doesn't look as if I'm giving an invasive response. It's just that we don't see it in everyone. But then, yeah, for certain persons, of course, it's evident.
Hmm. Okay, for women who are worried about injections, because you mentioned the something needles and vacuum and something. What happens in this process where somebody's uncomfortable with needles or uncomfortable with is it invasive whatever's? How do those kind of women, how can they go through that process?
Okay, so basically, there's no other way to do this procedure other than so nobody can run away from the injection phase, so to say. Okay, so usually, like I said, like I said earlier, I said this process, the act of egg freezing, consists of 5 phases. We start from, the initial consultation with the gynae or with the fertility doctor, down to the point of vitrifying the eggs. So, but there's a phase that follows the consultation, which is the phase where the woman has to take injections to cause the ovaries to the follicles inside of the ovaries to grow, more like to cause the eggs to grow inside of the ovaries. That phase is largely dependent on injections being taken externally.
Right.
Okay, so the injections will be given, usually there are different places to inject, and most of these injections are given subcutaneously. This is grammar. They are given, exactly, they are given under the skin. Okay, so that's what subcutaneously means.
Okay.
Okay, yes, so they're given under the skin. Some other centers might use injections that are given intramuscularly. It all depends on the brand of the injection that they use. Okay, but majority of centers these days use injections that are given subcutaneously under the skin. Usually they come like in the form of a pen with a very tiny needle, like the insulin pen needle, very tiny and short. So you just stick it into the tummy skin or the skin of the thigh or any other area that is designated by their clinic to inject. And then the fluid is injected. The medicine, the the syringe containing the medicine, okay, containing the medication, the hormone, okay, of course, will be injected. The hormones will be injected under the skin. So basically, the pain that is experienced is just like a pinch, usually when you use this modality, when you use the subcutaneous medications. Okay, it's just like a pinch, like as though when something just pinches you a little bit. So it is not so painful. Yes, there could be some complications from injecting the medications, like redness at the site of injection, slight swelling, usually which it's not sustained, it is transient, so it just resolves after a couple of days or so.
Right.
Okay, but that is the only thing that women have to grapple with. Okay, the other painful part of this procedure, this is not to scare anybody, is the part of the egg collection. So, but women cannot be awake for this procedure, like I stated earlier.
Yeah.
And this part of this process is done in the theater. The woman is put to sleep. The process just takes only between 20 to 30 minutes. It's not even, it's more like a mini invasive procedure. Okay. Yes, the reason is because it involves using a needle. The woman is put to sleep. She doesn't feel anything at all during this process. And by the time she wakes up, she's given a lot of analgesics. So she doesn't even feel pain. For centers that really know what they're doing, of course, they give a lot of they give painkillers so that covers the woman for a couple of days, and then everything then she doesn't feel a pain even after the procedure.
Okay, thank you so much, Dr. Collins. Let's talk about the cost and the accessibility of it in Nigeria, because Nigeria is not, we don't have lights in Nigeria, and you said it's inside the nitrogen chemical.
Yeah.
How accessible, how affordable is egg freezing in Nigeria? And for someone with average income, is this something that she can plan for realistically?
Well, truthfully, the saving for egg freezing is something that will require a lot of, let me call it financial discipline. Now, the reason is because the procedure is not cheap. So the moment was the fact that was saying that, okay, people should advocating for women to embrace or to do egg freezing and all doesn't mean that procedure is done for 200,000 naira. No, it is on the average. Okay, centers do this procedure for between 2.5. Okay, between 2.5 million to about 5 million naira on the average. Okay,
That's the
now
procedure.
that is for the procedure. This
Okay.
does not cover the monthly subscription or the quarterly subscription to keep the eggs frozen. Oh yes, just like you subscribe to your DSTV and the rest and whatever thing you subscribe to for your internet.
Right.
Same way you have to pay to keep the eggs frozen for a period of time. Certain centers make it even easier for you. You pay quarterly. So every 3 months, you pay a certain amount to keep it frozen for the next quarter. Okay, so you do that. So you have like 4 payments to do. So some people who have who were already prepared. When I mean prepared, I mean they were prepared both emotionally, financially, and always. Okay, so when they come in, they get the procedure done, and of course, they just pay for the entire year to keep the eggs frozen. Okay, so on the average, people will spend at least 1.2 million naira to freeze their eggs, yes, in a year.
Oh,
On
in
the
a year,
average,
not
on the
monthly.
average,
Okay,
yes, on the average, it is on the average quarterly payments around 400,000 naira to maybe roughly 500,000. Some centers do it more, but I'm just talking about the affordable options that are available out there. Usually between 400 to 500 quarterly. So every 3 months, that covers the payments for a 3 month period. And again, the next 3 months, so it's safe to say, January to March, you pay 400,000 to keep the eggs frozen. Okay, this is, mind you, outside of the initial payment for the egg retrieval procedure. That particular procedure in clinics costs between 2.5 to about 5 million naira, depending on where you're going to.
yeah.
Okay, yes. Then now we have to add the quarterly payment to it now, so which is between 400 to 500,000 naira quarterly to keep the eggs frozen. Oh yes. So on the average, you see people paying roughly that's 1.6 million naira, okay, to keep their eggs frozen for a year, for 1 year period. So you have to add that now to the 2.5 to 5
Yeah.
million
And
naira
by the
average,
number of years that you want to
and
keep
then
it.
times by number of days you want to keep it frozen for. So it is something, like I said, that requires a lot of financial discipline,
Yeah.
and you will need to save a lot in order to get this done. Maybe in the nearest future, maybe we'll start to have NGOs that sponsor women doing
Or even
egg freezing
HMO.
their eggs, or even HMOs. Just that's the story for another day. HMOs.
I
So
don't think that HMOs would get up with the program. I
uh,
don't think so.
uh, they have not even finished paying for paracetamol and the rest you give to
Yeah.
their patients. It's,
They're not finished
well,
paying
I'm so
for
sorry. I'm not
giving
taking
birth.
shots. I'm not
Yeah.
taking shots at
No,
HMO, so, but I'm just saying the
you can
reality.
take the
Yeah,
shots. You can take the shots.
yeah.
Because my sister was ill about 2 weeks ago and had to go to the hospital on her HMO, and she said they gave her the cheapest possible drug for HMO, and I was like, come on, so why am I paying for HMO? But yeah, we are rounded up. The last question I want to ask before we go is, for any woman listening today who is not ready, who cannot afford to freeze her eggs or is not ready to freeze her eggs, what can she do now, to protect her fertility?
All right, that's a beautiful question. So basically, what we advise is that the woman engages in a healthy lifestyle, healthy living generally, so that your eggs remain very healthy up to the point of where you're ready to use it. Yes, we keep clamoring or we keep sounding the alarm that okay, after the age of 35, it becomes more and more difficult to get pregnant. But then there are still women getting pregnant at the age of 35, 36,
Mhm,
37, even 40. Yes, the
mhm.
same 40 that was saying that it's going to be very difficult. A lot of women are still getting pregnant naturally, and chances are excellent that they also maybe had a healthy, like they engaged a healthy lifestyle, which of course also reflected in the quality of eggs that they had up to that point where they were able to get pregnant. So it is important to engage in healthy living, so avoid alcohol, avoid smoking, engage in exercises, reduce your stress levels, and of course take fruits and even take supplements. So generally, we don't. The African, or let me say the Nigerian culture is that we tend not to take medications until when we are sick. You know,
Hey,
yes. In fact, I'm even taking shots at somebody, the same person talking right now. I'm taking shots at this same person talking right now. It's only when you have one headache you start to take medications. But whereas there are medications out there that you can take to boost your body, it just gives you that sense of vitality
I
and it makes
agree.
you even rejuvenated. So it is important. We think that the body doesn't need supplements until when water has passed Gary. That is a wrong mentality. You can take
Yeah.
all the vitamins without having even a headache. It helps. And then you see a lot of women. In fact, these days, there's something that is happening. Some women take certain supplements in a bid to try to boost their skin health, but not their ovarian health. They take all the vitamins here and there because they want to glow in quotes,
Yeah.
whereas they can also take these same supplements and add some others to that to help their body generally, to help to preserve and maintain their ovarian health. Okay, because reproductive health is very important. I mean, infertility is not going anywhere. We're having a lot of people, the average, like I see, I was just doing a small study. We have about 14.5 to 30% of Nigerians going through infertility. It's quite a large number. Yes, quite a large number amongst the reproductive population. So it's quite a large number. And worldwide, these are the statistics we're also finding. A lot of people are coming down with one form of challenge or the other. 1 out of 6 couples must experience infertility. It's just the sad reality. So it is important people are more conscious and more aware of what they have to do to help their body to function reproductively to a very good age.
Wow, thank you so much, Dr. Collins. The shot is that we missed it. My husband bought supplements and has been shouting that I've only used it once because I'm not a tablet
A medicine person, exactly. That's the word.
So once I'm done, I have to remember to use it. If I don't want him to now remember that I've not been using it and he will now shout, I don't even have that kind of power. So anyway, thank you so much, Dr. Collins, for coming on the show this morning. We've learned so much about egg freezing and the importance of it. Dr. Collins is an assistant medical director and fertility physician at St. Ives Specialist Hospital. So you see that he knows what he's talking about. If you want to get in touch with him, send us a message and we'll link you up with Dr. Collins. Thank you, Dr. Collins, again for coming on the program.
Thank you for having me. It's always a pleasure.
Yes. Enjoy the rest of the day. All right.
Bye-bye.
This is the Women Radio 91.7. We have even great programming for you. Don't go anywhere.